Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Staffing Strategies During COVID-19 and Beyond. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've been doing through this crisis, and thank you for all that you're doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates as well. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenters will address them throughout the presentation. Today's webinar is being presented by Jacob Laufer, Senior Vice President, and Staci Grossbard, Senior Vice President, both with ShiftMed. The nationwide shortage of nursing assistants and nurses was dire before COVID-19, and COVID-19 has only amplified the issue while drawing national attention. This presentation will cover best practices related to recruitment, scheduling, and staffing strategies, as well as how to manage your agency costs. I'll now turn the webinar over to Jacob and Staci.
Well, thanks, Wendy, for the great introduction, and happy to have everybody out here today, and happy to be talking with the Pennsylvania Healthcare Association with my partner in crime here, Staci. We're really excited to be talking to Pennsylvania Healthcare Association members throughout 2021, especially as PHCA has recognized workforce initiatives as a top priority throughout this year, and we couldn't be more happy to contribute to that.
So we're excited to talk to you because we've come up with some great tips, not only for staffing, but also recruiting. And we've been sharing these tips and tools with our partners who we support in their staffing needs and have allowed them to become more efficient. Some of the tips we have today, there are tools that you can implement starting today and things that you can do right away to help your staffing and recruiting efforts. Especially now in these challenging times, we wanted to make sure that we're sharing these best practices and giving you the opportunity to use some of these things to improve your communities as well.
Yep. And as we walk through our tips today, we'll be sharing analysis from our own data, and well as like trends that we found as far as benchmarks that you can look to, as well as collections of hundreds of surveys and that we've done with our own employees, and has helped to calibrate and improve our own staffing technology, which this past year helped to hire over 5,000 healthcare professionals, ranking the ShiftMed app as the #1 nursing job app across America, and facilitating over 1 million hours of care for our clients. So we know that recruiting and retaining staff is the biggest challenge out there, and we hope that these tips allow you to be more successful at your own recruitment and staffing.
So we're going to get started. As Jacob and Wendy mentioned, feel free to ask questions as we go along. We know with this group you are muted right now, but we'd love to get your feedback as we present some of these tips. If you think these are things that you've tried that have worked, or if you have questions, want us to elaborate, feel free to put your questions into the box. Wendy, jump in as you see those questions, and we can certainly pause to answer them. And we'll have a couple opportunities as well throughout the presentation for any questions that you have. So we're going to jump in and start going through our pro tips and hopefully help you solve some of your recruiting and staffing puzzles.
So at the first start here, we're going to talk through where you should be advertising and to what extent. So I'm sure most people on this call have used Indeed to some sort of success in the past. And the first tip is that it is very true that they certainly do deliver over 2 times as many hires compared to any other source. But the thing that isn't as noteworthy is that it can very quickly become one of your most expensive hires if you aren't properly managing the cost of that recruitment. So on the right here, you can see, this was a really well done study by Breezy HR that found that Indeed, does in fact deliver 2 times the amount of hires. But what Indeed and other job boards aren't telling you is that you need to have appropriate budget caps. So we recommend looking and calibrating towards about a $250 per hire for CNAs and a $500 for nurses. And you can use a number of other technologies out there to help you manage your applicant flow, such as like an AppHoly, Smart Recruiters, or iSIMS, which can not only help you to manage, but can give you the analytics that you need out of the box to help distribute your openings to other sources. So once you have reached caps on Indeed, you can look to how additional advertisements going over to ZipRecruiter or Glassdoor or your own company career pages, which Google will actually automatically source and position for you. And so when you're looking at this, one of the things to note on that is that if you can also work with Indeed to figure out, what are the actual amount of CNAs in my area. So we grabbed a little snippet here just to share with you for Philadelphia as an example. So there's roughly about 40,000 CNAs in total, but only about 11,000 on an annualized basis are visiting Indeed, which isn't even a given week when you are actually recruiting for your very important needs. So you need to be monitoring these budgets because after a certain point in time, you're going to be recruiting, bartenders and cashiers versus actually looking to get CNAs. Now, it is true that they do have close to about 30,000 of the 40,000 matching resumes. So it's the best place for you to be, getting your exposure out there. The additional things is as you're looking to see where you can get additional advertising and exposure for, Staci, if you could go to the next slide. I don't know how many of you guys on this call are actually currently using your own company career page. But career pages have really never been more important than before. So it's not a very well-known fact, but actually your company career pages are typically the number 1 or number 2 source of hires. So you can see it in this another study where company career site actually ranks as the number 2, almost as much as Indeed delivers as hires. And the great thing about your company career pages is that Google in early 2018 really wanted to improve the job search experience for job seekers. So they actually went out and created Google Jobs, where they take all of the jobs that are out there and they match against all the different job searches that are happening on Google to present the best job for them. So, one of the largest pieces of content that Google is going to look for is actually those company career pages. And I grabbed, it's pretty small down in that slide, but an example of this morning where on the right here, you can see the Google Jobs widget to see where all the jobs are in your area. But what Google will actually do is go and grab your company career site and put that as the first button that's available for any job seeker in your area to actually apply to, so that they can go directly to the source and get hired quicker versus going through a ZipRecruiter, a Talroo, or Snagajob, which will have the job seeker actually sign up for a profile before charging you for that click. So, one of the things that at ShiftMed, over 50% of our frontline traffic actually comes from this. So, and it's not something that if you needed a web developer or anything else, multiple of these services actually will bring on and allow you to post a career page for free. So a company like Snagajob, actually, you can register completely for free and actually create your own company career page. And they will actually go in and have it be completely optimized for Google when you're signing up. So it's going to have all the proper attributes and allow you to have a company career page and a web presence there where you can actually get free traffic versus having to pay for a lot of the different clicks that you are on Indeed or ZipRecruiter or wherever else that you're currently trying to source candidates for. And with that, I'm going to flip it back over to Staci to help with really spotlighting your company.
Yeah, so with all the recruiting challenges, it's really more important than ever to just look at your company's brand and make sure that's being expressed and that's coming through across the web and on the career pages. So you really want to use this section to highlight your company's values, your goals, and more to the potential applicants. When they look at these pages and they find you, you want them to be able to envision working in your community, loving their job, working with you. And some of the best tips for how to convey the culture, it's going to be using video. So having your employees talk about their on-the-job experience, what they love about working in your facilities. Ask your employees to give you quotes about their job so you can have a picture of them and, put their quote about what they say about working there. It's going to bring a lot of authenticity to your company. The more pages of the more pictures of your team working together shown on your page, the better. And this is also a great way to re-engage your current staff. When you're asking your current employees what they love most about working there, it's a great way for them to remind themselves about all the great things that they love about the community, about the culture, and the team that they're a part of. And then social media is going to be a great way to convey this across the web as well. I think more than ever in 2020, everybody saw their work life and home life merge a little bit more than where it was. People are posting on social media about their jobs. You want to make sure they're conveying the right messages and using social media when they're able to, but have them post things about their great experiences about work. And then by having your own employees being your ambassadors, that's actually going to be the number 3 way that you can recruit. It's going to be from those employee referrals. The following is a video of a nurse who's having a good time at work. She's helping the facility look more attractive and showcasing how much she loves what she does. Also looking for opportunities to differentiate. One of our clients in Ohio, for example, they solved a lot of their recruitment challenges thinking outside the box and with a really simple way. They've been offering hot meals at the turn of the shift for their employees to enjoy. It was a small gesture, but it made a big difference in the facility, and they're now one of the most attractive places to work. You also want to designate someone on your team to be responsive to reviews online, specifically looking at Indeed, Google, Facebook, and Glassdoor. 70% of job seekers are going to review these ratings and reviews of you online before they decide to apply for the job. You want to encourage your best employees to go ahead and post their reviews. A four-star employers are the ones that are found to get about 2 times as many applicants. Let me see. So the other thing, so you want to make sure that you're investing the right amount of money on Indeed. You want to highlight your company's values and culture. And then you want to utilize your career pages to get as much free traffic as you can. And then the next step is going to be optimizing your job postings so that you can drive more applicants. So how many of you are putting, if you can indicate in the comments, when you're posting your jobs, are you using both the abbreviation and also fully writing out the job title? So this is one tip. If it's not something that you're currently doing, that's something you definitely want to start doing right away. From a search perspective, it's really important that you're including both. So for example, listing both CNA and certified nursing assistant and writing it out. Different people are going to search different ways, and you want to be able to match all of those groups in the exact way that you're searching so that your listing is showing. It's going to help you match more highly.
Responses. I'm sorry, excuse me. We have gotten some responses, and so far they're saying yes, that they do this.
Okay, awesome. Good to hear that you guys are on the right track. The other thing you want to make sure is that you're always putting your hourly pay rates in the posting as well. When the pay rate isn't listed, we see about a 17% drop off in the response to those ads. And then the last thing is looking at your job descriptions on your career pages. and including all the details with, as making it as complete as possible. So, for example, the employment type, whether it's full-time or part-time, educational requirements, experience requirements, industry skills. The more details you put in, the better. And Google, for example, is going to rank the complete job descriptions much higher than anything else, just to make sure that you're increasing your exposure and getting as many people as possible to see these job postings.
Yep. And so the next thing is, we really want to cover, you want to be at the top more frequently and staying top of mind with candidates. So, I can't see in the chat, but I'm sure a lot of people out there, has everybody posted something on Craigslist? You probably noticed when you have posted something on Craigslist in the past, depending on which classified you were posting within. But once you made that post, it was right at the top. And it turns out that all of the publishers' algorithms that are out there also give a lot of weight to recency. And publishers will actually give a premium to this. So one of the things that you can see here is, like, at ShiftMed, we actually refresh our postings every weekend. And when doing so, we actually saw a 40% increase in applicants. So having a member of your team going into wherever you are posting the jobs, or checking with your applicant tracking system to see how often that they're refreshing your jobs, is extremely important to getting more visibility on the actual search page itself. And you want to make sure when you're posting it that maybe you're adjusting and tweaking the title a little bit. So you can talk about one benefit, rotating the benefits that you're offering, keeping with the abbreviated term, plus the full term, and a pay rate to make it as attractive as you possibly can. The next thing is, and Staci, if you go to the next slide, when you're actually looking at when people are applying to your page, you want to make sure that you have a very structured onboarding program. So you can typically reach about, close to about 60% of your applications right away if you are immediately responsive to their applications. And there's a lot of different tools that are out there to help you make that immediacy and that connection, like a text recruiter or Maya, or many of your ATSs will also offer this experience in their subscription, like Smart Recruiters, Apoli, iSIMS. I even think that OnShift will help you with this. And you can actually further this experience by even using free calendar services such as Calendly at your facilities, where you can designate somebody to be a system to be automatically sending out this message right when they're coming in, and then using a free subscription or free service like Calendly, where the job seeker can actually schedule a time to meet that actually works with their schedule and talk to somebody at your facility. And this is something where, when you work through this structured onboarding, our percentage of applicants that actually complete the process, you can yield about 17% more from your applications. So think about all the money that you're spending on clicks to get job seekers interested in your community and wanting to get onboarded with you. You want to get as much return as you possibly can. And by having this continuous message stream, will allow you to get up to about, hopefully about 77 to 80% of your applications, onboarded and hired into your facilities. The other thing is we've been working with a lot of different partners, and we've seen a huge growth in, weekend programs, wanting to build out your own pool schedules, wanting to, do double programs on the weekends, or designating pool positions versus, regular full-time. And this isn't something new. We've all seen and followed the growth of gig work over the past couple of years, which was ultimately pioneered by the Ubers and Lyfts. But this is a large trend that you should embrace, and you can actually cover more of your own shifts by adapting to more weekend or pool scheduling practices. So the below chart right here is pretty interesting. So this is looking at Google search interest in full-time and part-time work, and looking at it from pre-pandemic of March of last year to post-pandemic, going out into where we are currently today. One of the things that jumps out, and this is somebody going into Google and saying, hey, I want a full-time job near me, or CNA part-time job. If they're calling out, I want full-time work or part-time work, or filtering for those in the Google job widget, that's what this is being reflective of. And one of the things that you can see is, obviously, part-time work took a noticeable dip as the pandemic started to happen, but full-time work actually fell, directly down to close to about 20% of its, pre-pandemic level right when the pandemic started. And it's really had a hard time getting up, where part-time work really recovered a little bit more over the summer. It's peaked up a little bit, but since declined. But being able to cater to this audience and this kind of shift in mentality and work is really going to be important to attracting the largest pool of candidates that you can in the future. And it's also something that, we've surveyed our healthcare professionals a lot about, and the findings are pretty surprising.
So this was a survey that we've done with our own healthcare professionals. And like Jacob said, findings were very surprising. We asked them what the most important thing was as to why they were working with agency. We hear a lot of people say, well, they go work for agency because it can make more money. And I was expecting that to be part of their answers. I was actually surprised, though, when we got over 250 responses, and it was actually only 7% of our staff that were looking for higher wages. 42% of the responses was because they wanted that flexibility. So, this is something that your communities can offer as well. With the part-time option, they can get that same flexibility working directly for you. And then when we dug in further to figure out why was flexibility so important, there were different responses, but 35% of the staff wanted that flexibility because they were in school. And of that group, 68% were on the path to becoming an RN. So, we found even with our own healthcare professionals that are working for ShiftMed, getting that flexibility so that they can both work as a CNA and also be in school at the same time was really important to them. And the majority of the time furthering their career as a nurse. So we had one of our CNAs in Chicago, we had noticed hadn't been taking up as many shifts as he was previously. So we reached out just to check in, find out what was going on, if there had been any particular reason. And he let us know that, he was in school while he was working as a CNA. As his studies were taking up a little bit more time, he was working a little bit less. But then once he did become an RN and finalized his certifications, he actually continued working with ShiftMed, now picking up our RN shifts. So a lot of benefits of just offering them that flexibility where they can be in school and working at the same time. And then having that career path, within ShiftMed, which I'm sure you'd see in your own communities as well, continuing to work with their higher degrees as they work through that with you. So just as a review, going over some of our best practices and, really looking into the data to support these and see that we could increase the time of hire from 29 days to 10 days and get 57% more applicants throughout this process. Review pro tip number 1, it was advertising on Indeed, but monitor your costs and make sure you're not overspending. Pro tip number 2 is optimizing your career pages for Google. Number 3, abbreviations and certificates, including the complete job description so that you're getting the best possible ranking. Number 4 is make sure you're refreshing your postings weekly. Number 5, that immediate follow-up and with text messages is so important. And then embracing the part-time and full positions just to make sure you're getting everybody who could potentially be working in your community. So we want to stop here at the end of the first section and see what questions we have.
Great, thank you. We do have some questions that have come in. If there's anyone who does have a question, please feel free to type it in your question pane, and we'll get to those now and again at the end of the presentation. So the first question that we have is, for Indeed, they are being told that if they post more than every 30 days, that they're going to remove the job. Is that what you're seeing as well?
Yeah. So what that is in response to is there's a legacy problem on job boards of having what's called a more evergreen posting, where they don't want to have a inactive job that's out there, and they want to make sure that the employers are being responsive to candidates coming in, so that the candidate experience is also matching that particular intent and actually helping the person to get hired. So instead of having the 30 days, what we would actually recommend is just refreshing those jobs on a weekly basis, and you can actually attract and get more applications as you're actually going in and refreshing those on a weekly basis.
Great, thank you. The next question that we have is, can you define poll positions? So pool positions.
Yeah, so when we talk about pool positions, is you can, there's two things. You can work with a traditional staffing agency or someone like a ShiftMed to help you fill your shifts, but you could also be hiring your own pool staff where let's say that you had a small list of people that just wanted to work part-time near your community, and as you needed additional needs, you could one of the things that we see, and if you go on to Indeed and search across different pool positions, but people are offering maybe $1 or $2 more for a pool position where it's more just part-time, and maybe there's different commitments there for 1 weekend a month or 2 weekends a month. But we see a lot of opportunity in attracting and positioning yourself to be aligned with, especially with CNAs, that people want to be looking for more part-time opportunities versus full-time opportunities, and even work with your other staffing agencies where, for instance, at ShiftMed, if you like a certain CNA that comes to your community and they really like your culture, make sure that you have contractual obligations set up where you can convert that worker at no cost. So you can move, allow other available staff in your area to try out your facility, because there's definitely a lot of employees and healthcare professionals out there that want to try out multiple different facilities before they come in and say, hey, I want to go full time here. And you can use all those different elements out there to your strategic, recruiting goals, and actually help to recruit and staff more for your own building.
Great, thank you, Jacob. Those are all the questions we have for now.
All right, well then we will move into the next section, and we're going to talk about some of our pro tips for staffing next. Slides to move forward. All right. So we're going to talk, like I said, some of the best practices have helped holistically with staffing. There are strategies that ShiftMed has utilized. One of the things we do is we always analyze the data that we're getting also, and sharing a lot of these tips with the partners that we support and helping them set their schedule up to have the best strategy in place. So the first tip is considering longer shifts. So our ShiftMed app is not only helping our staff find flexible work, but it quantifies a lot of our assumptions. So one thing that had continued to come up on our staffing calls with our staffing coordinators was talking about particular facilities that had been changing some of their shifts to 12-hour shifts as opposed to the traditional 8-hour shift. It seemed like our staff was really gravitating towards these longer shifts. So when we looked at the data, we found that the 12-hour shifts were being picked up 28% more than the 8-hour shifts. So we have a lot of our facilities that have now transitioned, especially for some weekend programs where they're offering 12 hours as opposed to the 8.
And as we just went through and talked, with the pool positions, having a weekend program can be very popular, as you need a separate strategy for your weekend staffing versus weekday staffing, given that it's not particularly everyone's preference to want to work every weekend. We happen to specialize and recruit specifically for that, but we have shared this information over with all of our facilities to help sweeten their own weekend programs and to consider using 12-hour shifts, especially at, most traditionally you see a 12-hour shift for a LPN nurse, but we're actually seeing this be something that is requested of CNAs, and it's something where you can, look to say, hey, if we have too much weekday staff and we need more people on the weekends, you may be able to reorient your whole schedule around more maybe 3/12 that could actually go out. So it's something that we encourage everybody to, talk to your own facility and survey your own employees to learn about that. And we think that one of the things that you'll find based upon the activity that we see within our app is that 12-hour shifts is actually a very high preference for those.
Yeah, it's been really fantastic to see and to be able to share with our partners and see how it's impacted their ability to staff their weekends better on their own. And that brings us to our next tip. So the other thing, it's important to look at the number of agencies that you're working with. We did a survey to better understand what makes some of our caregivers call out of a shift. We always are looking to eliminate call outs, minimize it completely when possible. And, again, we found some interesting results that came in. There were two main drivers that were leading to these cancellations. The first, emergencies obviously is going to be something that leads to people calling out. But then the next two were very actionable. The first one, it was frequent cancellations that was impacting the reliability.
Yeah, and what we see often with facilities using especially multiple agencies is that schedulers will typically operate under a first come and first served basis. So you can often have a caregiver that is very reliable and regularly working, not actually getting their shift confirmed because another agency potentially filled the shift with someone else. But communities, as we know, would rather see the continuity of care and having the regular continue to work.
And so one of the things that we've encouraged our partners to do is when they do have the favorite healthcare professionals that even through agency they love seeing come back into their communities again and again, they can put them on block schedules just to help counteract that. And we're going to talk more about cancellations in a bit. But the other thing and more concerning reason that we saw for call-outs was our healthcare professionals would pick up a shift through ShiftMed, and they would then end up canceling that shift with ShiftMed because they found another agency offering the exact same shift, but with a higher bonus or higher rate surge. And that was actually 17% of the reasons for a call out. We found it very concerning that seeing where a healthcare professional was still going to pick up the exact same shift, but just going to a different agency that was offering a higher rate, causing our clients to end up overpaying a lot more than they needed to for that worker to work at that shift. In some of our major metros like Philly, Chicago, and New York, we have over 1,000 employees that are on our app daily looking for their next shift. So you could be seriously overpaying for this overlap, and you end up paying an employee a lot more when they already had access to your shifts through ShiftMed. So that brings us to our next point, which is exposure. So ShiftMed tracks the daily active users that we have in our app, and 76% of our available app is in the app every 24 hours. So if you're looking to maximize your fulfillment, you want to post your shifts as early as you possibly can, because that's when you're going to get the largest amount of employees to see your openings. So we'll work with our clients to get ahead of their normal beg, borrow, and steal practices, and to get work on their scheduling to ensure at the latest by Thursday they have everything posted for the following week. Along the same lines, making sure by Tuesday they have everything for their weekends posted.
Yeah, and you can see, in a lot of these areas where communities are using these techniques to get upwards of about 85 to 100% fulfillment, which, brings us to one of the largest drivers of staffing, which is actually going to be cancellations.
So cancellations can happen. We get that. Sometimes the whole reason for working with the agency in the first place is because of that flexibility that you need. You may be sharing your openings with staff and agencies at the same time, and your internal staff is going to be picking up last minute. But one of the things that we'll do is we work with each of our partners' individual needs to understand these tendencies and help make their schedules calibrated as best as we possibly can. We'll also work with other scheduling vendors to ease the burden of reconciling. So, because it is such a huge driver of success. So one of the things that we'll see with our communities is when they have a lower cancellation rate, those are always the communities that by far have the highest fulfillment, regardless of where they're located. Overall, we're looking at a 28% cancellation rate being that breaking point. Any community that can keep their cancellation rate below a 28% is always going to be where the highest fulfillment is.
Yep. And so community cancellations is something that we spend a lot of time on and thinking through as one of the surveyed across even our employees' largest complaint is in regards to frequent cancellations, which really brings us to one of our latest innovations, which is we worked very closely with hopefully a couple of the partners that are on this call actually today on our latest product, which is going to be around guaranteed shifts. So as the COVID-19 pandemic really hit, communities were really hit with new staffing challenges as everyone's, just personal life was greatly impacted. So we all have had experienced new challenges with COVID-19 virus, but really frontline staff has really bared a huge burden of this, whether it's being worried about contracting the virus, childcare. Has a large survey thing where we found that 60% of our employees were impacted by child care closures, limitations around that related to COVID-19. So the available amount of staff has gone down tremendously as child care facilities close, or simply living with an elderly or high-risk family member, and even for some, the enhanced unemployment benefits have made the prospect of working not as exciting.
So we saw this all compounding with the labor shortages that had already existed. And in a lot of cases, operators were surging the prices for agencies, offering higher bonuses, and even automatic price increases that were upwards of over a time and a half to do anything they can to get the staff into their communities.
Yeah, and so we quickly realized, as healthcare ministers, grapple with this. You've had decades of shrinking reimbursements, and now having to face abnormally high agency bill rates. There was not a sustainable path here to warrant this type of increase. So we wanted to, and we worked with our partners to see how we could potentially bridge this gap with it just not being something that is always straight monetary. And we knew there had to be something in between, versus offering hundreds of dollars or time and a half to fill shifts. So we started to think about, our employees complain about cancellations. Our partners need more help, but can't seem to line up everything perfectly. And, we want to break the behavior of waiting for last minute bonuses or surge pricing. So it quickly started to gravitate towards what if we could figure out a way to guarantee the work opportunities to frontline staff?
And so this is where we saw guaranteed shifts come to be and when we launched it. So, I'd say the pro tip that this ties back into is just always looking for innovative and creative solutions, always looking for new ways to solve the same problems. In our case, our creative solution that we most recently came up was the guaranteed shift. So our customers can now indicate in their ShiftMed facility portal which shifts are guaranteed. And then when you look at the ShiftMed app, which is displayed on the screen, you'll see those shifts are designated with the blue flag as guaranteed shifts. So now when our employees go into the app and they're looking to pick and choose where and when they want to work, they look for these guaranteed shifts because they see that they know when they show up to work, they're definitely getting paid. They don't need to worry about their last minute cancellations.
Yeah, and so the response from our staff has been overwhelming since this release. So we see that guaranteed shifts get picked up. They're 20% more likely to be picked up. Employees are picking them up a full day in advance, so you're not waiting for Friday. It's now Thursday, and you have that peace of mind. And when you guarantee the shift, the employees are more likely to show up. They have about a 10% increase in their show rate. And ultimately, this goodwill has translated into some serious cost savings for a lot of our partners. So they're seeing on average their cost per shift go down over 11%, or about $3 an hour, which is fantastic. So it's also noteworthy that, you know, as you're looking at and evaluating your HPPD on a daily basis, is to think about cancellations even within your own staff, of being just extremely mindful of those. You know, a lot of people have spent a lot of time trying to figure out and make all the correct arrangements to make sure that they can work during this pandemic. And, you know, we want to make sure that when people are signing up that they have the opportunity to do so. And it can get extremely challenging with all the different census pivots that a lot of operators have had to go through in 2020 and into 2021. But, you know, just finding the right balance of that to make sure that, you know, if there is a cancellation, adding a personal touch to it, or finding an additional shift that they can potentially work, is all things that can help to create better goodwill and even enhance the culture of your own communities, you know, to ensure that you have just more coverage on your given weekend or given weekday as you monitor the, you know, if you're having to cut any type of staff.
So just pulling it all together and giving you our best practice summary on staffing specifically. You know, these are the tips that can help you with better staff coverage. You know, one was utilizing longer shifts and considering switching some of the 8-hour shifts to 12-hour shifts. Two was limiting your distribution of open shifts. Pick a couple partners. If you are using agency, pick a couple that you know you can rely on and try to limit to them. Evaluate your HPPD and request your shifts as early as possible. 4 is minimizing your cancellations. You know, consider saving on overtime or not burning your staff out and allowing that agency worker come in anyway so that you can minimize those cancellations. And then looking for examples like guaranteed shifts, looking for creative solutions, you know, always being creative and innovative to try to do things a little bit differently and see how that works. So any questions about either the second section of staffing pro tips or anything that's come up in regards to recruiting as well?
Any questions? Go ahead and type them in the pane on the right hand of your screen. We'll give it a minute or two. It was good information that you shared. Thank you, Jacob and Staci, for some good tips and best practices.
Thank you for having us today.
Thank you for having us, Wendy, and everybody at PHCA. And hopefully everyone hasn't had too much snow, and hopefully this is our last storm of the year. It's supposed to be close to 50 degrees, and so that sounds good at this polar vortex.
Seeing the light at the end of this winter tunnel.
Yep.
There is a question about the slides and recording. Yes, I will be sending out a link to the slides and the recording, likely either tomorrow or early next week. There's just a little bit of work I have to do on the back end to get that ready. So yes, look for those to be sent out.
And I believe Jacob's and my contact information is also going to be sent out, but you can see our email addresses are here on the screen for you. You can find both of us on LinkedIn as well. So we would love to connect with everyone who's joined us on the call. happy for any follow-up conversations or questions that might come up as well.
Yeah, if you ever just want to pick our...
We'll be providing that information in the follow-up.
Fantastic. Yeah, if anyone ever needs to brainstorm or pick your brains on, if you're having significant recruiting challenges, we're more than available just to even work through what you're doing right now in your recruitment and, what we would think to actually optimize that to help bolster your own recruitment efforts.
Okay, seeing no questions, I think we'll wrap up. Again, don't forget to complete the survey. Today's webinar is being recorded and will be made available on the PHCA website. The link will be in the follow-up email that I will send to you. And look out for more webinars. We've got quite a few scheduled, and we're continuing to build the 2021 webinar schedule. So be sure to take a look out for that. And our quality symposium is set to kick off on March 18th. So check the website for that. The agenda is out, and it's a robust agenda. So again, everybody have a great day. Stay well, stay safe, and we'll talk to you guys on the next webinar.
Thanks, everybody.